Coordinating Medicare and COBRA, what you need to know. Imagine navigating a maze of health insurance options, trying to figure out what happens when your employer coverage ends and Medicare begins. It can be confusing, but understanding how they work together makes it easier to make smart choices. If you have COBRA coverage first and then become eligible for Medicare, your COBRA usually ends once you enroll in Medicare. That's because Medicare becomes your primary insurance, and COBRA can't serve as secondary coverage after Medicare starts. You have an 8-month window after losing your job or employer coverage to sign up for Medicare without penalties. Missing this window could mean late enrollment fees and gaps in your health coverage. On the other hand, if you are already on Medicare and then lose your job, you can keep both. In this case, Medicare pays first and COBRA pays second. COBRA might cover some costs Medicare doesn't, but it can be expensive because you pay the full premium plus any costs your employer used to cover. It's generally better to keep Medicare active because it is your primary insurance, especially if you need ongoing medical care. Remember, COBRA is only available if your employer has at least 20 employees. Some states also have mini COBRA laws for smaller companies. COBRA coverage is temporary and can end early if you don't pay premiums, if your employer ends the group plan, or if you enroll in another group plan or Medicare. Medicare Part A, which covers hospital stays, usually starts automatically at age 65 if you qualify. Medicare Part B, which covers doctor visits and outpatient services, requires you to enroll and pay a monthly premium. If you delay enrolling in Part B while on COBRA, you might face penalties and coverage gaps, so it's best to sign up promptly when eligible. When you have both Medicare and COBRA, Medicare is the primary payer. That means Medicare pays first on claims, and COBRA may cover remaining costs. If you decide to keep COBRA after Medicare starts, be aware that COBRA might try to recover costs it paid that Medicare should have covered. Deciding whether to keep COBRA after becoming eligible for Medicare depends on your health needs and costs. COBRA can be expensive, but it might offer benefits Medicare doesn't cover. It's wise to compare costs and coverage options carefully. The key is to enroll in Medicare as soon as you're eligible, especially Part B, to avoid penalties and coverage gaps. If you're considering COBRA after Medicare eligibility, weigh the costs since Medicare generally provides comprehensive coverage at a lower cost. In the end, Medicare usually takes priority once you're enrolled. COBRA coverage often ends or becomes secondary. Knowing these rules helps you avoid unnecessary expenses and ensures you stay protected with the right coverage at the right time.